Hey there, Dr. Devon Coughlin here with Revolution Chiropractic, and today we're going to show you a brief video of a woman who is 32 weeks pregnant getting adjusted. We're going to do an adjustment here with Jackie, and then we're going to go through the Webster analysis as well, okay? One thing I'm going to show you, which you can't really see too well in the video, is that Jackie's lying on a cushion here for her stomach. There's a cutout in the center of that cushion there, and these are called pregnancy pillows. Allows her to lay on her stomach there very comfortably, and then that way we can properly assess and adjust her that way. All right, so we've been taking care of Jackie for a couple months now, so very familiar with her spine. And what we're doing here with the Webster technique is we want to analyze the lower back, the pelvic area here, and just make sure everything's moving properly. So we're going to start by doing an analysis where I'm going to bring the heels up towards the backside. Then with the table here is a very gentle way that we're going to get this area moving here. A little piece of the table pops up, and then it's going to gently drop down. I'm going to do that a couple times. Good. Then we're going to retest that. Good, good, good. Much better. Go ahead and take a deep breath in for me here, and let that all the way out. Have you on your side facing towards me here. I'm going to slide that cushion out. Perfect. So we're going to do a little bit more on the lower back and the SI joint, and we're going to bring this leg up just like that. Good. Relax there for me. Good. Let me have you go to the other side here for me. And we're going to do a very similar thing on the other side. Couple more things with the adjustment here, and then we're going to finish by checking Jackie's round ligaments to make sure everything's even and where it needs to be there. Be handy with that back. A little squeeze. Come on back. And we're just going to also clear out the neck here for Jackie. One more, just a little higher. Good. All right, so now we're going to be checking out the round ligaments here. Any tenderness on the other side? Which side has more? The right side. We're just going to do a little press and hold there. Again, we're not working on the baby here. We're actually just putting some steady pressure into Jackie's round ligament on the right side. And that steady pressure there, almost like a pressure point on a muscle. We just want to have that area relax, loosen up, and then that's going to make sure that those round ligaments are even. Just getting a little check up here on the baby's positioning as well. And the baby is head down on her left side, just what we want to see there. Good. All right, so that is simply an adjustment for a woman who's 32 weeks pregnant. Again, we did that adjustment, started with a Webster analysis, finished with a Webster analysis with the round ligaments. All right, it's been Dr. Devon Coughlin here showing you a Webster analysis and pregnancy adjustment.